Hello guys, so welcome to my YouTube channel. My name is Fanny Love. If this is your first time of tuning into my YouTube channel, please kindly click on the subscribe button and click on the bell notification so that whenever I upload a new video, you'll be the first to be notified. And to all of my returning subscribers, thank you so much for your support. So today I'm going to be talking about my pregnancy journey with the healthcare system in the UK. When I discovered that I was pregnant on February 2022, it was an exciting news for me and my partner. I was having all of this morning sickness that I needed to start antenatal as soon as possible. I decided to see the GP, also known as general practitioner, in order to start my antenatal at the health center. So when I registered with the midwife team, I was given an appointment to come back to see my midwife for the first time on the 8 weeks of my pregnancy. I was asked to do a series of tests. Blood samples were taken and urine to make sure that I have no infection. And they also asked me about my medical history on the 8th week of my pregnancy when I went there. Another thing they asked me was if I was already taking any pregnancy vitamin, which I told them yes, I was taking this pregnancy care, but it was making me to vomit a lot. So they gave me another pregnancy pill, also known as Healthy Start, which is recommended for pregnant women. I was advised to download an app called the Badger Note, where all the information that is related to your pregnancy is being recorded. This day they asked me about my family history, if there is any sickness in my blood lineage such as diabetes, if anybody in my family or in my partner's family, sickness that can be passed on to the next generation. And they also asked if we had twin in our family. And they always ask this particular question: how does your partner treat you at home? They don't want anybody to take advantage of you, even if it is your partner. So they want to know if you are going through any form of abuse. They asked about your mental health. If there is any problem related to your mental health, they will refer you to the perinatal team. They now told me that I'm not going to give birth to the health center, that I have to give birth to New Cross here in Wolverhampton. So I was booked for my first scan at New Cross Hospital, which is the hospital I'm supposed to give birth to. So when I went there, they did a scan, and that was when they told me, congratulations, you are pregnant. So here in the UK, they only congratulate you after your first scan on your 12th week of pregnancy. That is when they confirm that you are pregnant. The next step was to check on Down syndrome, that I was booked on the 16th week of my pregnancy. They took blood samples to do a screening known as Edwards syndrome or the Down syndrome. After the screening, they will let you know if your baby is autistic or your baby is having any form of disability. So the result comes after 2 weeks at home. So I received a letter that states that my baby has not gotten Down syndrome and that it was not 100% some Down syndrome. So I had already taken my COVID vaccines. Around the 18th week of my pregnancy, I had COVID. There was this fear that came in me. I called my midwife. Her number was not going through. I called the maternity triage. They told me that there is nothing they can do about the COVID at the moment, that all I need to do is to take some paracetamol. And they also recommended me to use a SAT to be monitoring my oxygen level. I was also filling this information on the Badger Note. There is a way they track it. So if you're pregnant and you're having COVID, just calm down. Don't be too hard on yourself. It is going to go away. SAT that was given to me to be monitoring my oxygen level. I returned it to the midwife. She talked to me. She asked me if I had any problem. I made her to understand that, oh, I'm just going through a lot at the moment to get rid of my past. So they referred me to a perinatal team. to assist me with my mental health, to make sure I do not stress a lot. They were so supportive. By the time I was 20 weeks gone, I had another appointment with New Cross Hospital. That was when I was told the gender of my baby. They will take you through the scan, they explain everything. That's the baby's leg, that's the baby's moving, that's the baby's gender. They will show everything. So I asked for the scan picture. Somewhere around the 24th to the 26th weeks of my pregnancy, I was asked to come and do the diabetes test. And these were the conditions. Breaking the day of the screening test, I'm not supposed to eat or drink water until the test is done. So I had to fast from 10 p.m. on the day before the screening test, and then I went on the morning of the screening test. They took some blood samples for the diabetes screening. I came back, and a week or so I received the result. I did not have diabetes. So around the 30th week of my pregnancy, I was referred to see a psychiatrist. He also referred me to a mental health specialist that was going to be following up with me to see how I'm able to manage my feelings. They did the blood test that I did before when I was 8 weeks pregnant. They did this blood test again that they did before, checking my blood group, checking my blood count, checking everything to check if I had any infection. I went for another scan. They had to check the baby, and that was just to examine the growth of the baby, and the baby was doing well. So within that time, I've been seeing my midwife, not too much to talk about. She asked me if I have everything that I needed for the baby. She just told me that there's a team that is responsible to support pregnant women. If you need any help, somewhere around 36 to 38 weeks, I went for another scan. So this scan was to know if the baby is breech, if I'm supposed to have a vaginal delivery, or if I'm going to have a CS. The baby was facing down. When I was 39 weeks gone, I started having these pre-labor signs. I was limping, I could not walk well. Baby movement was not really that active. Issue, I need to contact the New Cross Hospital directly. They asked me to lay down on the hospital bed, and they connect a monitor on me. So it was checking the heartbeat of the baby. So they'll come and tell me, oh, baby is happy, baby is not happy. They now concluded that they have to induce. It was like the second day after I was being induced. My partner came there, he spent some time with me, he waited for a while, and your partner is not allowed to sleep in the hospital with you. So he had to go back home 8 p.m. Around 12 midnight, I started having sharp pain that keeps coming and going. Around 2 a.m., I was taken in the labor room. There was this student nurse and other midwife that was there to assist me through the labor. That set of midwife was replaced to another set of midwife. So the second set that came, they were just there. I was feeling pain. I'll keep going down from the bed. I'll come back. I will be using all sorts of management techniques to suit the pain. I sat on this balloon that I never used in my life there, just to rock myself on it to see if I could get relief from the pain. But the pain was so much that I even shed tears. I did push-ups, I did squats during my labor, to the point that the moving, I'm not feeling any energy. I don't think I'll have that energy to push the baby. They just told me you'll be fine, you'll be fine. Do you know what this second set of nurses told me? They asked me to start pushing when it was not yet time. I went into the bed and I was pushing when it was not yet time. I was exhausting my energy for nothing. After that, there was another set of midwives that came. This last set were the best that I had, and they were the ones that helped me deliver my baby. So when they came in, it was around 5 a.m. that they came, and I feel the pain. I was pushing out for the baby to come out. They told me that no, make sure that whenever you feel the pain, just use the gas and air. Breathe in and breathe out throughout the labor process. I drank too much water. 5 a.m. I asked them that how much time do I still have to go. They said I will be delivering the baby around 9 to 10 a.m. and I was like, oh my god, I felt like there's too much time left for me to go through with the pain that I was already having. My legs were not moving. Around 9 a.m. that they asked me to start pushing the baby from the pain. Before that 9 a.m. I wanted to give me surgery. The pain was too much. I cried. I said, please, you both should take me to the bath. Let me go and do a pool bath. Oh my god, it was so much. Like, it was crazy. When I think about the moment, the emotions, it's not story. When you give birth, the pain is no more there. So when I was pushing, it was still kind of like challenging. There was this midwife, her name is Madison. She was so lovely. Like, she told me that the baby is facing upward, that's why it's difficult for the baby to move. So the movement was a bit strenuous for the baby. At the point, she had to use a method to help me get the baby out. And my partner was also there. He was like the #1 midwife. They would tell me that, oh, when you're pushing, don't leave your bum, or make sure your bum is lined. And my partner was also explaining, oh, Fanny, that's not what they meant. You have to listen to what the midwife is saying. Make sure your bum is seated on the bed while you push. I held my legs. I give it a long push, and she helped me hold the baby. Like, she used this technique to hold the baby and get the baby out of me. So it was so lovely. I held my baby. I was like, thank you, Jesus. Thank you, Jesus. And I was so happy that I was able to have my baby safe and sound. So after I had the baby, I also suffered from blood clots. Doctors and midwife managing the situation gave me a couple of syringes. I was also given a pile of syringes. I think it was for like 13 days. Today right, tomorrow left. They were able to manage the blood clot. If not, I don't know what would have happened to me. So far, that is my pregnancy journey. If you are happy about my pregnancy journey and you want to know more about tips that I'll be sharing here about my lifestyle in the UK, about my cooking skills, about my health, about healthy living, please guys, kindly click on the subscribe button and also click on the bell notification so that whenever I upload a new video, you will be the first to be informed. Thank you for watching. Love you all.